Hi, my name is Kelsey and I'm a CVT here at DLEAH, and this is an assistant, Megan, and her dog, Varro. Varro also happens to be a blood donor and I run the blood bank, so today we're going to be doing a jugular venipuncture, just a draw for his PCV before he donates today. So, we're up on our donation table, so this can be done on the ground as well, but today we're up here. We're going to put our thumb in the thoracic inlet here and just hold off, and then that allows me to sort of be able to palpate this vein a little bit better. You could hold off on both sides. That is one method to do it. I personally just like to use my thumb widely against it here. I feel like it gives the dog a little bit more even pressure and is a little bit less uncomfortable. So from here, you can usually follow their hair cowlick and see where their jugular vein would be, palpate and see if it's there. You can wet it down with alcohol. That can help as well. Today, since he's donating and we're doing this video, we're gonna go ahead and shave the spot first. So it's a little bit easier for you to see. Good boy, Varro. Normally I would not recommend holding your face this close to a dog you're about to put a needle in. This dog's face anyways. Good boy, Varro. Very good boy. All right, so now that his skin's shaved, we can sort of see a little bit more easily the actual vein. You can see here, you can palpate it. When you palpate it, you should hopefully be able to also feel it sort of bounce below your thumb there. That's how you know you're holding off in the right spot. All right, buddy, you ready? So today I'm just gonna use a 3 ml syringe. We're gonna go in at about a 45-degree angle with the bevel up. I am gonna go ahead and squirt with alcohol first. I know it's cold, I'm so sorry. All right. And then draw back, you should be able to get blood. And then when you're done, some light pressure. And then you could also have your assistant hold off if you need them to. So there are some other positions that you could put a dog in for a jugular draw. So one way, if the dog prefers standing, you could get them up against a wall and ideally back against a wall, because then they cannot back up. If you have another person to restrain and help hold, you could have them on the other side. But they can be standing, and you can have your restrainer just gently lifting their head up like we did while they were sitting. You could hold them against your body like this. They could be sitting on the ground and in the same position that Varro was on the table. I do think that it's best to have their butt either up against your restrainer's legs or up against a wall, because the first thing they're going to want to do is back up. So if you can hold them, Varro, sit. Can you sit? Will you offer treats? Will you sit for treats? Can you sit? Good boy. So having your restrainer directly behind the dog and holding their head like so makes it so you can come and get in here. I know, I didn't even give you the treat yet. There you go. And then they can't back up into, if they do, they go right into their restrainer. So this is a good way to restrain as well. And that is how you collect blood from a jugular vein on a dog.